What's going on, YouTube? Thanks for clicking on the video. My name is Caden. I'm coming to you with a video about my hysterectomy consult that I had on Wednesday. Just wanted to make a video because a lot of people were asking me a lot of questions on Instagram about it, so I just thought I'd address it all kind of at once. I just want to give you kind of a comprehensive overview of my experience with the histoconsult itself, and then discuss kind of what my next steps in the process are going to be. First of all, hysterectomy, for those of you who don't know, it is something that anyone can have. It's not just exclusive to trans people, such as things like top surgery are more kind of geared towards the trans non-binary community, unless it's for a certain medical reason, and that is a different process of bilateral mastectomy. So histo is anyone can have it, depending on what their needs are, or what they're, if they're doing preventative measures for certain types of cancers or illnesses and things like that. Hysterectomy is going to be the removal of your sex organs and your uterus. As far as my histo process, there are two kinds of histos that you can have. You can have the one that just removes your uterus and your cervix, or you can have the one that removes your ovaries, your fallopian tubes, and the uterus and cervix. Sorry if I'm using triggering language for anyone. I'm trying to keep it anatomically correct so you guys know what I'm talking about, but I won't try to overuse any terms here. I didn't even know going into it that there were two different types of histo. I thought either way they're going to remove your ovaries. I personally wouldn't do that just because I have a history of ovarian cysts that have been very serious. So I do want them gone, obviously, and they're going to be gone. But the other thing that she kind of told me why some people choose to leave them in versus take them out. If you do decide to leave them in, you do have to continually keep up with pelvic exams. So I know a big thing for trans men really don't like going to the gynecologist. It's a female-centered space. Typically, even when I just went to this appointment, they had me wait in like a separate waiting area. So there was like the women's benches here, and then there was like another curve of benches, and they told me to go sit over there. And I just felt really weird about it. There was these two old ladies like gossiping about why I was sitting there, why I was even there for an appointment, which I had never even had that experience before, so it was a lot. So I was just kind of sitting like by myself in this weird area. I think it helped that my appointment wasn't until like it was the very last one of the day, so it wasn't super busy in there, but there were people who did notice, that I was there and why I was sitting over in a separate section, and it was just kind of a weird vibe. But anyway, so that's the kind of histo I'm having. I'm having everything taken out. I am having it locally here in Boston. It's not a surgery that I'm planning to travel for. I found a surgeon, OBGYN doctor who came very highly recommended to me through a friend who also had histo from her. So booking the histo, they make you book two separate appointments. I don't know if this is universal or if it was just my process because I had never been to that practice before. But they made me book one appointment on January 16th, and that was going to be for an ultrasound. To just kind of get, photos of all my organs, everything like that. And then I had to schedule my histo consult at least a week after that. So that was when I actually met with the doctor. It happened to be January 31st, was this past Wednesday. When I went to the ultrasound, this was kind of step one. I've had a lot of stomach ultrasounds before. I've had, many different stomach issues in the past that have required me to have ultrasounds on my stomach. So I wasn't really nervous about it. So she did the whole, stomach ultrasound, whatever. It was fine. And then got kind of sprung on me. Those of you who saw my Instagram post about this on that day, they told me they had to do an internal ultrasound as well, which, really didn't make me excited to hear. Obviously, that is an extremely triggering experience for those of you that have never gone through one. It's basically it's essentially what they do when you're pregnant. They take this device, it's probably about this long. It's literally like a plastic dildo, not to be, vulgar, but that's exactly what it feels like. It's a medical instrument, obviously. So they literally like lubricate it and, just like put it inside you, which sucks. And it has to stay in there. I'm probably overestimating because it just was so uncomfortable physically and emotionally that it felt like so long, but I don't think it really was. I think I was only at the appointment for 45 minutes. So this part of it probably took 5 to 10 minutes, but it just felt like a lifetime. I mean, she just had to keep moving the thing around. Like I was physically, it hurt. It didn't feel good because, a lot of transmasculine people don't like to confront that part of their anatomy. Obviously, it's triggering, and so a lot of us don't do anything really penetrative down there. So as far as that experience, physically very uncomfortable, and then the emotional side of it obviously just puts it in your brain that, you know what, this is anatomy that you try to forget all the time, and here's somebody manipulating it in a very uncomfortable way. That whole experience, it sucked, but the tech was very, very nice. I had a really nice ultrasound tech. She was very respectful, you know, kind of walked me through the whole thing. So it was like the most comfortable it could have been for what it was. So then fast forward to this past Wednesday, I did go meet with the gynecologist, surgeon, OBGYN, super, super nice woman. She said she does, I think, 200 hystos a year, and she says about 25% of them are trans men. The initial part of the meeting with her was a lot of just going through the informed consent. She asked me a lot of questions. Because I had never met her before, she asked me a lot of questions about my transition, my family life at home. I had to bring a big questionnaire about my medical history, family medical history. And then she kind of walked me through the surgery as if, you know, she was just explaining it. So she had a diagram on the wall. She also had a physical diagram in her hand. She was showing me kind of how everything works and how they go in. It's a laparoscopic, so they make very, very tiny incisions, right? And then so they insert like a camera so that they can see, and it's a very microscopic level how they do the surgery. So that was kind of, she was explaining it to me on a diagram, like showing me where she'd have to move certain organs, how she would be pulling them out, different things like that. We talked about it a lot. She actually gave me my pre-surgical wash that I would have to use the night before surgery. She already gave that to me. So everything's a go. Like we're having surgery with her. It's official. I just need to set the date. I need to call her scheduler on Monday, and then we should have a date. I am looking for June, July probably. I'm not able to take leave off of work until I've been with the company for a year, which would be May 1st. So I'm looking around that spring, summertime. We had a discussion around the surgery. She explained everything to me, the recovery process. And then one thing she did have to do, very brief, not a full pelvic exam, but she did have to just kind of like put some fingers in there and just make sure that it was going to be feasible to pull my organs out. I guess some people, it's just not stretchy enough or wide enough that you can't actually pull the organs out. So they have to do it a different way. So that was the only thing. It was very quick, obviously not comfortable again, but it's just a necessary part of the process. So that was essentially it. I mean, really cool. I get to book surgery now, which is great, very exciting. I am nervous about it. I haven't really, I feel like it's just kind of happening fast, even though it's, 4 or 5 months away at this point. But ultimately, like, really cool to go through the consultation, even if you're not sure. She did ask me if I planned to have bottom surgery, and I told her I wasn't really sure. I was kind of on the fence about the methods. I'm hoping that the technology gets better over time, so I do want to wait. I've seen a lot of complications that just really, I don't think personally I'm comfortable going through. She actually thought the same thing. She said she advises her patients to wait on phalloplasty for a couple of years, or not even just phalloplasty, any sort of bottom surgery, because the medical technology is coming around so much around trans identity that they will have new methods coming out for this in the near future, next couple of years. So she said if you're not really in a rush, definitely recommends to wait. So that's kind of my thinking was, histo, I have had issues before, so taking those out would eliminate a lot of that problem for me, as well as the fact that this is a necessary step to take if I do want to have bottom surgery in the future. Everyone's journey is a little different. This is not going to be everyone's journey. Not everyone wants to have histo, and that's totally fine. I just feel like it's kind of the next step in my process. Some people get histo before top surgery. It really depends. Like, people just have different things that trigger them more. And for me, this just wasn't something that bothered me. It was top surgery had to go first. And back when I was planning all this, I wasn't even going to go on T initially. I just wanted top surgery. And then it wasn't until a conversation with my doctor that he explained a few things to me about what my body would look like without the T. And then I kind of realized, it is, a full transition that I want. It's not to be in a non-binary space. And some people do. Some people want to be in that non-binary space. But for me, it wasn't really what I was looking for, and I thought it was. I just really wasn't deeply confronting what was going on in my brain at the time. With that being said, I am going forward scheduling my hysterectomy pretty soon. I'm going to call and set a date, and I will inform all of you when I do. Please feel free to drop any questions below, message them to me, message them on Instagram, DM, whatever. I'm happy to answer any more or make a follow-up. Please, guys, let me know if you liked the video, if it was informative for you, and then I'll try to improve on things. I'm just trying to give you some more informative content at this point. With YouTube's new metrics changing, it is even more important for you, if you like someone's channel, if you like their videos, to just drop them a like. It really helps with their metrics, with how they show up in YouTube search, things like that. So it really helps to grow the channel. So if you have any YouTubers that you're fans of, please go ahead and drop them a like or a subscribe. Really helps the channel. Would really appreciate it, guys. If you got something out of this video, hit that thumbs up button. And yeah, see you guys at the next video.